Good evening, everyone. Viewers of Fort TV, you're most welcome. It's a health hour. In studios, I'm at NAUME, and with me I have a special medic. His name is Frederick. You're most welcome. You can introduce yourself.
Thank you very much. My name is Frederick Innocent Aderi. I have been here before, so I'm not a visitor.
Okay.
It's just that maybe because of classification, hassle, we don't get time to share. But I am happy that I'm here again.
Thank you.
All right.
Olwale muno atikiro kya leero tubaleetera entanda tugenda ku bantu bazaha bulwaire obwo bw'omunywero rundigete HIV/AIDS. Dr. Frederick, kiki exactly actually tukura nti obulwaire obwo bweyongeire muno recently mbaine ndora statistics nizolekya nti actually Footpoto is Kabarole is being ranked in number 1. Nti nito tuina abakufuna infections ezo abakusingayo mu ihanga. Bubwo nkabwo, what is it exactly?
HIV is a virus. Nkokutwala tuina COVID-19. HIV nayo virus. Kuleta obulwaire bwa AIDS. HIV kaija in the early 80s. And in the myths nyingi zabaire hao. You know, there are some people who say kaijamae kawaza agenda munkende, things like that. But bottom line here, it is a virus.
Yo munkende kabandizayo urundi hate mu bantu ekaikaye
it is ikisobora kuba mananu, ikisobora kutaba mananu. But the fact is, it is a virus and it affects human beings. So wera wayawandize munkende rundeta wandize sobora kutaba kikuru baitungu most times HIV hiyo nka virus ine special attributes ezine zitakusana viruses ezine
nkazira heza.
Tuine many viruses, tuine virus yokuleta, for instance virus yokuleta cervical cancer. Nabo bulwaire bwingi muno bukanyire mukabarole muno. Around HIV recently bagambire 17%. Kimanisa abantu 10 abokutunga abantu almost abantu babiri nosanga baine HIV AIDS. Obulwaire buno buleta wa virus ya HIV. HIV kakuba tugenda kugibaza muno tusobora kutagimara baitu. HIV virus yonga is an RNA virus. Naturally cell rundi akatafali ko muntu akakumalirayo akakora umubiri karum genetic material. Genetic material no mugaso goku making sure ngo omuntu yagira obomezi yazara haba population yendi haba generation yendi yabantu. So a virus zinu hizo the HIV in particular ne affecting akachweka ka DNA yako. So we genda muselu wegne influencinga kukora ebyaye bye kwende kole. Wano yitegereza. Kuba natural cell in a nucleus. Nucleus are DNA, hati DNA ni yokoragira cell ekira akora. Haroho information rundi obutumwa obukuba buroho ngwewo muntu obwakura akora nati. Bwabule ha DNA.
Hati yori mukukwata aho henyine
neremesa program egyo kugenda maiso nayo tujja kurora hawo.
Hati omuntu akubata kyakuro rundi
nakura.
Kande kubekwasira katafali kanda kakuwa byokukura byokora ke.
Naturally nucleus enu tekukora mulimo gukura kuonga. Actually hiyo HIV wekuwa ne affectinga te kwa affectinga kukura oro ne affectinga protein synthesis okuntu hatwagihara baitungu obwiro bukukira ne influencinga nkokusele ne kufunctioninga
lekitwala umuntu wale ekuba ne koranka kubi muno ndi ne koretyo abo kuba nereka cell ne korebya HIV. So in other words cells nziba stakyal zawo ero nziba cells za HIV. hati yose HIV nekore byayo bindi
hati
ekora bindi nkakyaho
nekore byayo bindi so aro ekintu ekinkugonza kubazaho ekyo omuntu wawe ratamanyira heruko ngo HIV yeno bwe kumara kuhika musero yawe omubiri gugera abasurukale b'omubiri okay abasurukale b'omubiri bali specialized nkoko kurora hano mu Uganda twine SFC twine UPDF twine police twine prisons naturally hati no mubiri nago gwine special cells is adapted to do different work so
prison ba police kulinda law and order then bali kulinda
then arona aba identifying ngo hati wewe haro umuntu yatutahira then haruna abakuja kumutera amasasi so they are not the same people so naturally HIV hiyo we kuja abakine ba special muno ngo we kumara kutaha muselu muno cells in the immune system ne recognizing gamba wamanya tuaba attacked oburoiro bundi bona for instance oroire typhoid immune system is alerted we twarumbibwa typhoid so kumara kwetegereza mtwarumbiwa typhoid cells zinu zona ezine typhoid na haija markers
nizimanyikibwa nti ene irwaire typhoid
pale kunyetegereza so those markers are called interferons but that is deep science so kutajai so cells zinu niziba marked ono arwaire so na haija na nend nayo type ya immune system itkota lymphocytes and neutrophils hizo nizija nizimera cells zino izirwaire nizifanazo
nizigimara
exactly scientifically kita phagocytosis wetu
so mubiri zikuba zihoire
so kumara kuzita immune system newe kozera umulimo gwaye actually no muswijo guthuro tuwatwino buroire buno it is a sign immune system yawe iriyo nekoraki
nerwana
so one of the effects that shows that the immune system is working is fever, inflammation, pain, sometimes no kuzimba na redness, cardinal signs of inflammation. So HIV hiyo hawaki neba special muno ngo we kumara kutaha mubiri abasaija bali benyine abakumakinga cells ziri ezigama ngwati zirwire hibo nibe kuanza kuatakinga neba directing abakole kintu kindi these cells that it attacks are called CD4 cells na CD8 cells
hati zino nizirema ku identifying angene ndwaire ndwaire nizikana zimanya it is no
habwaki ne korekyo ngo bwe amara kuzitahamu ziri ezikumakinga zikaburwa it can use sobora kukozesa cells rundi obutafali bwawe kukora cells ezindi ezayo
habo kube buzabulize it is like a camouflaging
so mubiri tuguri awe yangu actually gwine HIV virus yenu kukuba tujagibazaho in other specific features but when we go back to the HIV that is how it comes about it attacks the type of immune system that is responsible for marking cells
atikanda mubiri kuno mubiri gwo muntu cells zino za HIV virus ene kumutaha mwita
so hati HIV obwe kumara kutaha mu mubiri hati nitwenda hati niko tukwenda kubazaho how do you get HIV hiwo wali aheru silimu no bitungota naturally karabuli obutwali ntukura halalo presidential initiative strategy on AIDS strategic communication to the youth but hati biro binu ningira utwabairaho twategereza ngo HIV is something we can live this with somehow we tend to be negligent HIV emiringo yo kuspreadinga tekahindukaga bayiraba ngo kutugimanya no kweri ekyo kubanza no kubanza ekikukerayo obuchweka 10 kitwara kinana na busata buri 10 kweterana no muntu waroiro obwere bwa HIV utakozeseza condom direct sexual contact with a person who has HIV. That is the first way of spread. The second way of spread is mother to child transmission at birth. That one also contributes around 23. Actually, in this aspect, into Gonzamuno kusima government ya Uganda. Ugandan government has really embarked on the war against HIV, because when HIV had come, we used to have 93% mother-to-child transmission. Kubora awareness HIV, umwana warazara 100%.
Now abana HIV.
Exactly. Unless
nemsangayo mubiri mu.
Unless babachuzi babo bakwasiroti ya mkwata. So right now the government has reduced this to almost 0.0.
Ate mama bakuba roire HIV akozera atakurora nti omwana atagifunire. Stop that mother to child transmission mama kola ata.
Hate kionakyo tujja kukibazaho oherole kamaze maleyo habo emiringe yokutunga HIV. Emiringe endi yokutunga HIV nuko kwechumita. Body fluids zao zikafuna contact na body fluids omuntu ina HIV. For instance, omuntu omchumisize nkinzo amara gichumisa nayo wakoraki
wayechumita.
Omuntu wawe na sari nono ya yesara nayo akawempa we na kosa kusari nono nayo wakoraki wakesaza. Okusobora gifuna no na kyaisara immediately rundi bwekumaranka some hours akubata kugifuna. Ntugamba omuntu ayichumisire nka saha nka 10 then akakyora omuntu arwaire slim then akakyora kwechumitsa that very rundi syringe rundi kawempe kareza saha nka 11 12 akawuka kubanika kyaroho rundi kakuba karugiro. Hiyo HIV virus te surviving muno ha surface. Actually science negamba ngo it survives, it only would stay surviving for 3 to 2 hours. But why would you take that risk?
Anti bakubakozere nkensobi.
So it is 2 to 3 hours. But nkokoburwere butasoma bitabu. It is always better not to take the risk. You say you know we say diseases don't treat what?
Don't treat books.
Diseases don't treat books. So ideally HIV enu in the myths nyingi na sahazin no tuli mu 21st century with all the communication, with all what the government has done to disseminate, to politicize this HIV to the population. Acharu myths zogamango muntu nibakoroga no tunga silimu. So emiringo yo kutunga silimu commonly niyo twabazahi.
Mwana kwegata no muntagi na then no kwechumita.
Exactly.
So ebyo kulya rundi sharing kajiko nalisize spooni alirira plate
rundi obyamire nawo mwayesweka hamwe
mwayesweka blanket
rundi onyegira omuntu
rundo ikalire mu ntebe ye.
Not true munasobola kutunga HIV. So owe kumara kutaha munda mu mubiri wa mara kufuna direct contact and HIV akagaining access to the cell nikitware saha obwireki kuja kurora wetegereza ngo ati you have an active disease. Obwiro bukira kuja kufuna active disease ya HIV takes around 3 months.
Nizonka signs nizolekya
seroconversion, to get a seroconversion. Emazere kutahira ya converting cell genetic material yao yona igikorekia kwenu ya replicating
biri byona kurwanisa omubiri byabibuzabuze camouflaging ire omubiri gufuire gwayo hate gwefugire.
Nikitwara 3 months.
Okay.
So it is always true. Research says that owiro bukukera omuntu kuja kurora wa mchekinga wasanga HIV positive, it is likely to take 3 months from the time of exposure.
So still akusa kuba ina HIV eri mu mubiri but nkeyo kwezi kuma kuba kutakusobora kugimanya.
Exactly. Exactly. No kimanyota mwine HIV.
Wakusobora kuba na spreading mu kwezi kumukono gonzebwe kubeta kolekeza.
Owiro bukukera omuntu wakuba atakatungire seroconversion nikiguma kutura HIV. But still now, why do you take the risk? It goes back to the same question I was asking. Why do you take the risk? Okay. So HIV higa manano agali, it is still a mystery. It is still a global burden. And recently Kabarole district we had 17% spread ya HIV mu district yetu ya Kabarole.
What exactly is causing that? Tuli baingi kabarole, are we just having a higher population than the rest of the districts in this country, or only there is something else?
Ekyokubanza white presenter is human behavior. Fort Portal Kabarole district is more of a tourist city. And you know what happens during tourism? Hospitality. Actually, Watoro here are known to be very hospitable. But the hospitality ni kwenda kusaba ngu tutagitwara hospitality yoku exchanging sexual contact without protecting ourselves. Ekyakabiri ekinkutekereza abwake.
So too much hospitality kusa kuba niyo cause one of the problems.
The nature of the people. The nature of the people.
Yeah, too hospitable.
Exactly. Ekyakabiri ngu maybe it is because we test. I want you to take an example. Ngu hanu mu Uganda we still have a district. This is national data. It is not my personal data. We still have a district that has almost 48% y'abantu batachekingira HIV. So kakuba abantu 48% baba checked. Osobora kusanga nsobora kugaruka hansi. Last year it was Kalangala and Mbara. And this year it is Fort Portal. There was a time when it was lower. But there is also a feeling that if we actually took a national-wide campaign to check HIV up to the zero grassroots, like how it is done in Fort Portal, maybe we might not be the first.
Okay, so it is also possible that it's just because we are testing, exactly. So the results are there. It is because we are cautious. Okay. And these results, by the way, for us to tally these results, they have to reach the national data. So it means our health system is actually working. A health system, it is very easy for you to identify that, you know what, there has been an outbreak of a disease. But how would you know if your health system is non-functional? You cannot know. So actually, it is how many are infected. It is also fascinating that in a space of 1 year, we already have almost a national data. There are people who will take 5 years checking their entire district. So it is good that we know. Because this information helps us to reckon our faith, to reinforce, to set new strategies. Like I want to appreciate for TV for coming up. Now this is coming up to see how media houses and media live stream can help us sensitizing. Exactly. So this is very important. This is very important. But also, a lot of negligence happens around the people in Kabarole. Yes. National statistics here in Uganda show Fort Portal 76.3% of the people who live here are youth. Youth who are below 35 years. True. What do people of 35 years do? That's what we should ask. Exactly. They are sexually active. That age bracket, 35 and below, they are doing a lot of... They are very active. So you'd also look at the population of the place. Okay? And most of them are getting to learn about this sexual activity. So that is one of the reasons why these stats are really rising and they are alarming. It's not like it has not happened before, but it has to make us develop fear and put precaution when these stats come out. It is not true. We have to make a change. So what can we do? Tuzigariro hansi rundi tukyakwatwa muno kuzikuolekya nti abakukwatibwa bayingi. What can we do to avoid that spread? Eri haiguru muno. Wale muno presenter. Hati ekyo nikyo kirungi kyokuja Fort TV hano. Muneyo wale ahero kwa wera atakumanya yangu you are at a risk. You should know today that you are at a risk. Everyone is at a risk. Exactly. Now, the first step should be you going to check.
Yo borabole hano in the last 3 months tukacheckingaga HIV, please. For Porto Regional Referral Hospital, the services are free. Kawarole Hospital Church of Uganda, the services are free. Morik Medical Center, Karago, the services are free. Kazingo Health Center for Bukuku, services are free. So it means you wenka ni okuba no enagiriza kusanga sazi ntomanyire HIV status yawe. So it starts with you knowing your HIV status. Kandi
bonkubangi manyire tinjina ankozere ntakulora nti tingifunire.
Exactly, that is what I was arriving at. So after you knowing your status, there are 2 directions to take. 1, you know you have the HIV. 2, you don't know you don't have the HIV. So one question should be, how do I prevent myself from having HIV? And 2, how do I live with having HIV? Now I'm going to first answer the first. HIV we kumara kuinfectinga cells z'omuntu. Twagamba ngune how CD4 na CD8 cells. These are interferons that are supposed to mark cells. So cells was marked. Immune system never damaged. No sanga abasurukale babo mubiri bona kauka ko munywerero kakabita bona toine nakati
bakyarwana no burwaire obundi bwono bukujja mubiri
nibutahamu. Very good. Ati nekizibu ekindi wait presenter nibusobora kutaha mu mubiri baitu nabo tukumanya ngo obwine haboko immune system ye supposed kutoleka ngo obwine naye kozereki tero. When you tegereza medical from the medical part, we have what we call IRIS, immune reconstitutional inflammatory syndrome. Abarwaire bona baturukusanga baine HIV. Tubanza tukora baseline check up. Tukora kuchekinga kukurorora aboine kintu kindi kyona. Oburwaire obuli common muno abantu abaine HIV abankoro ya kakongo. TB. Ya kabiri bageta cryptococcal meningitis bitu baburwire bw'obwongo.
Kube kutahira mbongo orundi bonka bo bukubani bwizire abo mubiri kucheka
mbuba bwizire abo mubiri kucheka. Aro burwire bwingi muno kaposis sarcoma. Kaposis sarcoma bageta kisipi. Kisipi. Herpes zoster and shingles no sanga haso kwali ensundu zikuzire no obuhere bukutire above and below the belt. Naturally omubiri tukujya kukimanya ngo urwaire until obutukumara ku introducing HIV drugs.
Hata hoten homuntu akuba natinira kutandika HIV abakuba there is this saying nti most people obu abanomo naba aina manige sainta kurararwara bakwata kimanyire nti aina HIV. But why is it that some people were finding out nti aina HIV na signs nizija oba kutandika ARVs na signs nizija? Actually that is one of the reasons abantu batina kora kutandika emibazi abakwa it's like bukakutandika emibazi no burwaire naboni butandika kora ni buzoka no kuzoka omuntu nakumanya nti you know ona ina HIV.
So nikyo twaba tuliyo ntubazahe ke wait present immune reconstitution. Ikimanisi immunity riyo ne koraki. So hati immunity no wekuba negarukaho abo jomba sanga bakabarumba ira, so the body becomes overwhelmed.
Hati
CD4 na CD8 obusukubani zije abo kubo bokutunga emibazi yawe ya silimu netanga mechanism of action embazi ya silimu haliyo netanga viral replication
netanga buli kweyongera
netanga cells nkwekara nizichwamu nizikora zindi zinakahuka komunyi.
So zitandika tizikweyongera bwingi ate zine zibaire nomwezi bamazire amani nizitandika kufuna amani.
Hati obwiro obukukira HIV cell hiyo ne survivinga no kwekara nechwamu nekora zindi kakuba aho
wire ezibaire nomezi sangire ziri supposed ku engulfinga interferons ziri what happens with them. ARVs tekuzigaruraho.
Hati ekinaba ninyenda kuanza kugambira ngu cells zino obuzikuba zitakureplicatinga za HIV. HIV nefu. Tukuligamba unebe fireho ireo nabaro cell yegine betitekureplicate mu earth clinic babagamba ngo huka bukwijagire obutumazera kupima viral load twasanga viral load enhance. So emibazi ya HIV obutumaragiho omuntu ekakesha replication yenu ekaita nobumu viral load replicating hati immune system yongere tandika kugarukaho. CD4 cells garuka, CD6, CD8 cells garuka. Hati obuzi kugaruka sanga TB ziri, streptococcal pneumonia ziri, KCPA ziri. So it becomes overwhelmed. It starts calling neutrophils where we are attacked before we could defend. Now we are attacked before we could even hear. So you get acute inflammation. Omubiri nuguba very disorganized. Chorona barwera bakukira obamara kufuna uburwere bwa HIV tukabateka amibazi baruwara kiwaba nobaza. Ekyakabiri ngu obutumara kuchekinga HIV. These days we use the test and treat principle. We test you are positive, we treat. But we are supposed to first run baseline tests. Nyingi nka 10. Oburwere bunu obwine nangu. Buno obwine nangwa CBC tugikozere sagama ya rumu nangwa viral load ningananka CD4 count yawe ningananka such that tukusanga obwere no burwire buno tubanza ntu treatinga for 2 weeks.
Okay.
Such that you don't get overwhelmed. And in case you get overwhelmed, quite high doses are steroids, prednisolone, dexamethasone. So ekyo nje tukweta immune reconstitution inflammatory syndrome, very common when someone is starting HIV drugs. But that is not what is important. What is important in taking HIV drugs is that iyo bokumara kumira emibazi yawe mubwiri to get intensive adherence no gimera mubwiri bara bagambira utandike gimera sahina zekiro zikuanzika nino koraki no mera akajuma
kane bakwinguza what happens urundi ayeberwe saha inazimurabiroho yajuka sanka munana kikuba nikimtalibaniza
mun ikiwanji kutalibaniza. So abarwere nkabo tubateka mu intensive adherence counseling. Obokubo mubaze otagumira mu bwire tichikukuyamba kukesha abasurukale bawo tichikukuyamba kukesha viral load yawe rundi obuhuka kubukuijagiza. So we always encourage these patients to take their drugs in time, at the right drug, at the right time, in the right place.
Atukandi embaze na roho bwegendane batalibanizamu nka side effects ezo. Bagamba omuntu atandikire kunyeta abnormally nasanga matama makoto, the rest of the bodies zitemi thorundi nikibao nka side effects ezo akuba na akorata nikibanke mtalibanizamu nko mubiri rundi nzimuokya.
So HIV drugs hizo nkazo zina side effects nke mibazi yona kyona kumayangu buli mubazi guona mu mubiri. If it is not treating, it is poisoning. Okay. But to even muhamebazi ya HIV tegaba manano hati nkeke ugama ngo muntu wakumire emibazi mazima amatama tigala manano nyama tamanka gazimbe
anti gakwingana
I don't take HIV drugs. But to ngu emibazi ya HIV yenu obo kugimera in time it stops viral replication. So no kujagiza viral load yawo no imcha wasurukale babo mubiri. Okay? Haro myths nyingi nazo tujja kuzibaza ngo wagamba munyowe mayesagama batagire hanu akantu ngoli nawe in HIV aka strict ka reactinga. Most of those things are not true.
Another bagamba omuntu bakuba HIV na miremi bazita kutulira. Is it possible?
It is possible. Actually, national statistics say Sazin HIV spreaders are 0.03% spread. it is 1 out of the 50 people you sleep with that give you HIV. But how sure are you ora ukuja kubyama nayo nyecha than wakuja kikuisa?
So
most times
there
when
is still a probability ntakusako baina HIV baitu na takutulire.
True. Nikisoboka. Ngomuntu no wabaire na mireme bazi yenu yagmera for a long time yagmera in time kandi yakora ebintu ebyabantu ba HIV ebitukuba demanding abakole, for instance getting enough sleep, having a good nutrition, having a good sex life, avoiding stress and finding something to do. So ebintu bino babikozere kurungi emibaziye nagimera kurungi viral load nekea to even 0. So it is always, I wouldn't want to say this on TV, but it is possible ngomuntu nosobora kubyama nawe atakuhaire HIV nikisoboka. But it is also a very big risk because diseases don't read books. So you don't go and assume angene muli because they are taking drugs. No.
Then there hariyo bana bakugamba nti someone can have sex no muntu ali infected but nawe natagifuna as long as tamhatingire tabairo nkateya tabairo.
You see things of sex. Karabuli to abagantu nturuhana nturugahizo bagabo banurwana no muntu gamba atakunaganka timanyiri obo banurwana no muntu gamba atakunaganka ejo thikuja kibasa. So when you're having sex with someone, do you say you go slowly you will hurt me? No, it is a moment of pleasure, and what happens in pleasure is always very regrettable at the end of the day. So when you're having sex, you're not sure whether this person has the wounds inside there. Are you sure they don't?
You can't be sure.
Can't be sure. So it is true ngomuntu nosoa kuyama nawe in HIV attack spreading, but it is only possible if this person is adherent on treatment for a long time. Actually, we say around 10 years. And his viral load is suppressed to 0 levels and his CD4 count is normal. So arone kintu kindi eri saidi ya bietu wena tujakuwazao iyo watakatungire HIV. Ekyo kubanza, practice safe sex. Okay?
Yeah.
Everyone is sick. Me, I'm sick, you are sick, everyone is sick. It is only me who is not sick. There are very many ways how you can find out whether someone is actually sick or not. Exercise patience. Please, youth, be patient. The woman is not going to run away. Yes, exercise patience. Take this person to a health center. Have them checked. Don't do this test yourself. You make mistakes. There is someone who is professionally trained to do this. Take this person, have them checked, okay? And when this person is checked and you're sure they are not HIV positive, there are other things, of course, that will happen. For instance, HIV is not the only STI. Yes, we have hepatitis B, for instance. We have syphilis. We have chlamydia trachomatis, you know those things. So if you actually take this person to screen them for these STIs, it always puts you at a better advantage. That happens if you cannot avoid having sex. But if you can really avoid having this sex, then avoid having the sex. And then be faithful to one person that you have already checked and you know that this person does not have what? HIV. Don't move from here today. You go to Proce, you go to Rita, you get. So I also have a feeling, I have a fear now, a cancer that is going to break out of people having HIV strips in their homes. We are all doctors now. Just like someone said, we are all secretly babas. We are now also secretly doctors. Because now everyone is testing. But do you know how to read this strip? Have you read the guidelines of the strip? That is a very big thing. But also, there is someone who is still listening to this, and even tonight, you're going to go to a bar, get drunk, and make one useless decision. Tonight, you sleep with someone. whom you have not tested. So these are types of the risk behaviors we are talking about. And I want to inform all the youth of my age that HIV is very real. That is true. It is still present, and it might be present for a long time, and it kills. That's the fact. Because when HIV is converted to AIDS, you get an active AIDS disease. Then there's nothing else we can do apart from keeping you on drugs. Okay, now, if it has happened, you have had sex with this person, they are HIV positive, we still say, yes, there is another chance. You come and we'll give you PEP.
PEP?
Yes.
For how long?
We normally give PEP for 28 days. So PEP is... it is a mechanism, or it is a drug we give within 72 hours of sexual exposure that helps you prevent you being infected with HIV. You already have contact with HIV, but it helps you prevent getting active disease. So it stops entry into the cell, it stops replication, and it helps you avoid getting HIV.
Okay.
Statistics say that
as long as you get PEP within 72 hours.
Exactly. Actually, statistics say that 93% of the people who take PEP are not likely to get active infection.
Okay.
If you have taken it adherently and in time. Then there is also what we call PrEP. You see, HIV has really been simplified. It is us who are now being negligent.
PrEP, and what is PrEP?
Now, PrEP is a situation whereby you're married to someone, they have HIV and you don't have HIV. That happens in HIV. It is called discondenance. You are a discondant couple, or you expect that, I'm traveling to Kampala and I'm going to Fort Portal. It is highly infested with HIV, and I'm very horny. I may make a decision which is bad. So if you're going to travel to Fort Portal, in a week's time, you start taking PrEP.
For how? For 7 days?
So PrEP is, it might not have a date which is specific, but it is pre-exposure prophylaxis. Pre-exposure to HIV toka kitungira, prophylaxis ikimaisa kutangirai. PrEP is post-exposure prophylaxis, after you have had contact. So we normally use it even in malaria. If you're someone who is doing tourism and you're going in, say, a forest in Kivali, and you expect a lot of mosquitoes there, we have drugs that are responsible for prophylaxis. Kutangirayo ngomuswija emubuno bugora kuruma already ogutangire, the plasmodium may not replicate. Similarly with HIV, no sobora kwema yangu wewe nyowa amehone guy. This is the youth. We have to live with the facts. Someone tells you, me when I take 2 bottles of Uganda Waraji, I'm done. I see everyone in the club as a beautiful woman. You get it? So take this PrEP, okay? If you know the area you're going in, you cannot prevent yourself. Take this PrEP. If you have multiple sexual partners, for instance, people who have lorries, long distance drivers, prostitutes who work on streets, and anytime you're going to, you are at a risk. You are going to get HIV anytime soon.
Use PrEP.
Take PrEP.
Dr. Kaireka tukwasire in 1 minute osibureho ba viewers then or before otugambire na how a mother pregnant HIV akusobora kutangira omwana we kufuna HIV bakuba nagenda kuzaala ndi nakyalo munda. Then after osibure ba viewers ba Fort TV.
Kale otomuno presenter elimination of mother to child transmission of HIV has been one of the global health concerns, whereby PEPFAR, most non-government organizations in health, even USAID, even BAILA, have been embarking on a mission to make sure that mothers who have HIV do not give birth to children who have HIV. Therefore, we eliminate a generation of people who have HIV and create a new generation of people.
How?
So it starts with antenatal care. Obora twarenda today, antenatal care says in guidelines is gamba. Obora twarenda kirukino, antenatal care netandika today. Okay? So when we go for antenatal, of course this is medical, right too. There are drugs we give. Okay? There are basic checkups we give. Routine ultrasound scans we do. Okay? And health medical care advice, which we might not say all of it here, that we give to mothers. And preparing for you a birth plan. Making sure that your blood and the baby's blood do not get contact at any one point. But this is only possible if you if it is only possible if you can go to the hospital and you do a routine antenatal and follow up all the visits that these nurses and midwives give you to go back to the hospital for checkup. So it is quite detailed. The science is big, so kutagiwaza gimara, but ningoza kusima muno aba staff na management ya 4 TV, our producers, nayo the host for allowing me kutungobwire buno kusharing nayo about HIV. It is alarming, but we have the situation under control only if we stay disciplined to what we already know. Thank you very much.
You're welcome, Dr. Innocent. Thank you so much for ebyonna byoturabiremu watusomesa ba viewers ningira tulirire kandi bagenda kubiteeka mu nkola amabara ninyo watugonza NAUME. We meet next time.
Thank you very much.
Okay.